Thank you. The Honourable Emily Suvaal.
Thank you, Madam Assistant President. Never too young. That's the message of Bowel Cancer Australia's advocacy agenda, which seeks to improve care and outcomes for younger people that are diagnosed with bowel cancer. Bowel cancer is the deadliest cancer for those aged 25 to 44 and the 7th underlying cause of death overall for that age category. Madam Deputy President, on the 3rd of September, I attended the Enkindle Hope fundraiser organised by SIS The Label. I was joined by my parliamentary colleague from the other place, Minister Jihad Dib, and I know Matt Cross, MP, the member for Davison, had wanted to be there on the night and was certainly acknowledged. SIS The Label is a non-profit and charitable organisation created to raise awareness and essential funds for bowel cancer research. It was founded in memory of a beautiful woman, Afroz, who was diagnosed with stage 4 bowel cancer at 33 years of age. Tragically, just 3 months and 2 weeks after her diagnosis, Afroz passed away at the age of just 34, leaving behind a beautiful 10-month-old son and a grieving family. In the words of her family, she was a mother, wife, daughter, sister, Carla, and friend to so many. Her presence is missed every single moment, every single day. The name Afroz means to illuminate and brighten, and the family's aim is for this organisation to bring light and hope to those affected by bowel cancer. Afroz's sisters, Meroz and Semab, are the driving force behind the organisation, along with a village of amazing volunteers and committee members. Their aim is to raise awareness and raise funds for research into bowel cancer so that others may have access to more modern treatment. The sisters were devastated that when Afroz was diagnosed, the only therapy option available for her was over 15 years old due to a lack of research in space. It's their connection to their beautiful sister in the afterlife through their faith as they grieve her loss. They honour her enduring legacy. The event was one of joy, sadness and hope. Attendees included young bowel cancer survivors, their families, and also the families of those who had lost their struggles with bowel cancer. Most compelling was the lived experience panel, a group of young women who shared their experience of diagnosis and, in some cases, living with what was stage 4 bowel cancer. Those young women all had one thing in common, and that is that they were initially dismissed by a health professional regarding their symptoms. That was unacceptable. Bowel cancer is not an old person's disease. In fact, 1 in 9 Australians that are diagnosed are under the age of 50. If you were born from 1990 onwards, you have double the risk of colon cancer and quadruple the risk of rectal cancer compared with people born in 1950. In the case of Kate from Victoria, who was diagnosed with bowel cancer while she was pregnant with her first child, so dismissed was she regarding her symptoms that she ultimately presented to an emergency department and refused to leave until they ran basic tests. She had a mass the size of a softball in her abdomen that was ultimately effectively removed by quite radical surgery, which involved removing her entire uterus with baby intact and then reimplanting. She survived, her baby survived, but the story could have been so different. In the case of Nina, a paediatric nurse from South Australia, she was diagnosed initially with stage 3 bowel cancer at the age of 41 and underwent treatment. She recounted she had symptoms for about 2 years. She's a busy working mum, school-aged children, shift worker, all the rest. After initially receiving surgery and 6 months of chemo and an all clear, Nina was told her cancer was back in June 2021 as stage 4. She's since endured dozens of procedures, including a HIPEC surgery where her abdominal cancers were removed and her insides packed with heated chemotherapy. Her outcome is uncertain and she lives her life in 3-month cycles. I want to commend her for her ongoing work and her advocacy, not only in young onset bowel cancer, but also for someone that is living with a colostomy bag and the awareness that she continues to raise in the community. Jess Kidd, journalist with the ABC, for sharing her story on the night also. Her only symptom was low iron. Free bowel cancer screening is now available for those aged between 44 and 49, but only on an opt-in basis. I want to thank again Afroz, Samab, Kate, Nina and Jessica. It's an honour to speak of your advocacy in this place.
Thank you. The Honourable Wes Fang.